Confused about hormone therapy? I was too. Pills, patches, pellets, what to take, what's safe. You need to do your homework to figure out what works best for you. I'll break down what I learned on my journey and what I landed on. Hi, my name is Amy. I'm in perimenopause and I had all of the symptoms. A couple of years ago, I met with my doctor who specializes in working with menopausal women, and she gave me 3 different options to try. I'll go through those options for hormone replacement therapy in this video and let you know what I decided on. Before we start, feel free to give me a like and subscribe to hear more about my menopausal journey, sharing what I am learning to help other women be more informed about menopause. First up was pellets. So the doctor explained to me that pellets are literally little pellets that have either estrogen, testosterone, or both that are inserted into your hip or into your butt, where they stay for 3 to 6 months. That sounded interesting because you don't have to remember to take anything. But thinking about it, I was worried because number one, they're synthetic sometimes, they're not bioidentical. Sometimes they are, sometimes they're not, but also the pellets are not FDA approved. The stuff in them is, but the actual pellet is not. And my concern was if I have this pellet put into me and I have adverse effects and I want it out, there's no way of taking it out. Like I have to ride that roller coaster until it dissipates into my system. So that was not an option to me. Like it wasn't FDA approved. Sometimes it's synthetic, it's stuck in my body. Like that was a no-go for me. Option number 2 was the birth control pill. And I've been on the pill years and years ago. I was on it for a very long time. And so doctors will prescribe birth control to women in menopause because it has estrogen in it. Again, sometimes it's bioidentical, a lot of times it's synthetic. There's been studies that show there's higher risks of cancers from some synthetic kinds of estrogen, although they're still researching that, but there's a question mark because it's synthetic. Bioidentical estrogen, there's a very low risk factor. In fact, it's very beneficial for your body. I'll talk about that more in a minute. But you would take it and it is absorbed through your liver. So when that happens, for older women specifically, there is a higher risk of blood clots and strokes. And I have a friend who's my age who is taking birth control pills and she had a stroke and she's not in good shape from it. I don't know if it's related, but it's the one thing they pointed to that could have caused it. So knowing that was enough for me, but also having it go through my liver, I thought there must be an easier way. And so the third thing that was offered to me and the one I landed on is an estrogen patch and a progesterone pill. And the patch is transdermal, so it's absorbed through my skin. It does not go through my liver, so there's very low risk associated with it. It is bioidentical, so the risk of any kind of cancers associated that you get with a more synthetic estrogen is much lower. And bioidentical estrogen is perfect for your body because your body needs estrogen literally for everything. And that's why older women kind of fall apart so quickly because they lose all the estrogen, they have bone loss, they have memory loss, they have heart problems. Estrogen helps all of those things. So I chose to go on the patch. I have a patch that I put on twice weekly, every Wednesday, every Saturday. Right now I'm at 0.75. I started on a lower dose, but realized my symptoms were kind of coming back. So I've gone up in dosage as I've needed to. I also take progesterone, and you need to take progesterone only if you still have a uterus because it's protective against the estrogen. So I take progesterone 200 milligrams at night, and that protects my uterus. And if I'm on it and I started it and I didn't like it, it's easy to stop. I can peel the patch off, I can stop taking the progesterone, I can stop it very quickly if I need to. You can't do that with a pellet. Birth control pills, you can do the same thing. You can stop those fairly quickly. But I thought just for me, because of the transdermal way that the medication comes into my body, I thought that was the best for me. So that was the decision I made. I'm not saying if you've decided to go on birth control pills or pellets that that's wrong at all. I'm saying that that's the choice I made for me based on my level of comfort. I'm very good about taking medicine, very good at it. So I never miss a dose. So I knew I'd be very good at like putting the patch on regularly twice a week, taking a pill every night. I knew that was going to be the best fit for me. And I will tell you, I've been on HRT for 2.5 years, and almost all of my symptoms were gone after a month and a half. I'm still in perimenopause, so my estrogen is still going up and down. But for the most part, I literally feel like I've been plugged back in. It's been life-changing for me. And I really am on here just to tell women to not be afraid of doing your research and to looking into hormone replacement therapy and to finding a doctor who will listen to you. Because a lot of doctors, especially if it's your primary care doctor, don't know enough about menopause and will kind of poo-poo it and say, just ride it out. I've heard that from friends. Or you're too old. Heard that from friends. Or this isn't for you. I've heard that too. And I was told, I can't help you. You need to find someone who can. And so I did. So I'll link some resources below to places that you can go to if you're having a hard time finding a doctor to help you. There's a bunch of different telehealth medicine companies that work with menopausal women specifically that can point you in the right direction and give you the health care that you need to help with your symptoms and to help with this part of your journey. So that's where I landed. I'm happy to answer any questions you have about it. I'll put some links and information below, but please share with me your journey. Have you heard any crazy comments when you've mentioned your symptoms to your doctor? Are you taking anything? Which one are you on and why do you like it? All this information helps our community of women to learn and to share and to be more informed about menopause. And again, if you've stuck around this long, give me a like and subscribe and join my community of women learning more about menopause and sharing our journey.